Hello everyone, I'm Dr. Nyoja. Today I'll be talking about 10 signs of breast cancer that people usually ignore. So if you've not subscribed to my channel, please since you're already here, subscribe to my channel. I'll be giving you more health talk and that for you to have awareness of your health issues. Thank you. So the first thing I'm going to talk about is nipple retraction. Now, nipple retraction is when the nipple of the breast points inward instead of pointing outward. Normally, there are people that naturally have the nipple retraction. For those kind of people, you don't need to bother yourself if that's how your nipple is. But for some others, that the nipple normally points outward, and then you discover that suddenly your nipple is now pointing inward, there's an issue. It can actually be caused by infection, trauma, or cancer. Now, when cancer grows inside the breast tissue, especially when it's directly under the nipples, when it grows, it tends to cause nipple retraction. So one of the signs you should not ignore as a woman is nipple retraction. Another sign that you should not ignore is skin texture changes, especially skin dimpling. Now, skin dimpling occurs when there is too much fluid in the breast, especially when the tumor grows and then it occludes the lymph drainage of the breast. So there's fluid accumulation in the breast. Example is when the skin look like that, like the back of an orange. That is what we mean by skin dimpling. If you see this sign as a woman, you should be worried. Then go and meet your doctor to examine your breast to know if actually there's a cancer growing there or not. Another sign I should not take for granted is unusual nipple discharge. Now, nipple discharge occurs in some women that are pregnant, occurs during breastfeeding, and some women that are seeing their menses. Normal nipple discharge mostly is whitish, some are yellowish or milkish. But in a sense, in the case where it starts seeing milkish that contains blood or greenish in color, especially occurs in only one breast, you should actually see it as a danger sign. So I would advise you go to see a doctor to give you proper examination to determine if it is actually a cancer causing the nipple discharge or if it is something else. Swelling in the armpit or collarbone usually occurs when the breast cancer cells tend to spread to the nearby lymph node. And lymph nodes are part of the immune system. They are being shaped. So when breast cancer spread through them, they tend to swell up. So a woman that has breast cancer, you tend to see it as swelling in the armpits or around the collarbone. So if you see these signs, it actually means that the cancer cells are actually spreading beyond the breast that is infected. So it's actually a very serious sign. Persistent chest pain or breast pain, this sign should not be ignored. Most times when cancer cells are spreading or growing, they tend to affect the structures that are close to the breast or within the breast. So these signs, this compression that actually happen to those structures actually present as pain. Some people would say that the pain is dull, or some people see it as like a raw or sore pain in their breast. So if you're having persistent chest or breast pain, you should go to a doctor for proper examination. Warmness or redness of the breast. Now, for us black, our breast cannot get red except those that are actually fair. So if you look at one of your breasts is usually warm compared to the other one, you should actually go to a doctor for a proper checkup. So again, if there's redness or warmness in one part of the breast, you should go for a proper checkup. But since most of us are black, you cannot see the redness. If you feel that one of your breasts is usually warm compared to the other one, it's actually a danger sign. Go to your doctor for proper checkup. And that's I need to watch out for is change in size and shape of the breast. Normally, for most humans, the two breasts are not equal in size. One is usually bigger than the other. For most people, it is usually the right side of the breast that is bigger than the left side of the breast. But when you are noticing considerable difference in the size of the breast, you should take that into consideration. It could be a sign of breast cancer, especially when the changes is occurring in one of the breasts. Fatigue and tiredness. You know, most times when you're stressed from work, you tend to get tired. But when you notice that you usually get tired compared to your usual self, that is actually a sign for concern. So breast cancer, or most cancer, usually causes fatigue and tiredness. So frequent fatigue and tiredness, especially when you've not done anything that warrants you to be that tired, should be a red sign for you to go and check if you have breast cancer or any other form of cancer. Persistent fatigue and tiredness also can result from anemia. So most breast cancer cells tend to consume nutrients that can lead to anemia. Anemia most times presents as that fatigue or tiredness that you have most of the time. One is plain weight loss. You know, most people tend to lose weight or they tend to lose weight. But when you just notice that there's a drastic change in your weight, especially when you're not even making effort to lose weight. That is actually a sign of breast cancer for a woman and can be a sign of any other cancer too. So if you notice that you are not having or you are not making effort to lose weight, discover that you are losing weight drastically, it's actually a sign of breast cancer or some other underlying illness. When you notice an ulcer on the breast, either one of the breasts or two of the breast, that is actually a very serious sign and a great pointer to cancer. So immediately you see that, it's better for you to rush immediately to the hospital for proper treatment. Don't ever try to treat an ulcer on the breast at home thinking you can just sit at home, take some drugs and then it will go. Go straight to the hospital for proper treatment. The earlier breast cancer is detected, the more effective the treatment is. So if you see any of these signs, please hurry to the hospital. No need to stay at home and try to do self-medication because when you present to the hospital, it might be too late. So while you see, even if you see one of these signs, it's better you go to the hospital to tell you, okay, you're okay. Now for you to stay at home till you get advanced where there's little or nothing any doctor can do.